Hey, this is Erin from Educated Nurse, and I'm doing a lecture series on what it was like to go from an ER nurse to a breast cancer patient survivor and back again. Lecture number 5 in this series is to Cut is to Cure, and I'm going to talk all about my journey through my mastectomy. I do want to put a disclaimer out there that this video is for instructional purposes only. The information shared is my story, and it's not everybody's story. None of the information shared should be considered expert medical advice. The information presented should not replace the information provided by your doctor. Please work with your own doctor to find the best course of treatment for you for your situation. Also, I will use medical terminology which may not be suitable for children. And please also be aware that I'm very honest. I tell it how it is. I don't sugarcoat, and for that I apologize for the occasional profanity. My mom always said to cut is to cure. In June of 2016, thank goodness, it finally arrived. A month after I was done with chemo, I was ready for my double mastectomy. They want you to wait a few weeks to flush the chemo out of your system and so that your blood counts come back up so that you're safe and you're not at risk for bleeding or infection, not at increased risk, we'll say that. And really, I wanted to get this done as soon as possible. I didn't want to wait any longer than it needed to be. Before surgery, I had a pre-op physical with my primary doctor, and I had basic blood work to make sure my red and white blood cell counts were up and my liver functions were okay post-chemo. I met with my general surgeon to review his plan and what to expect during and after surgery. I also met with my plastic surgeon and picked out a new set of boobs. This was a great appointment, probably one of the more positive appointments I had ever had. And while I did have to wait to get my real implants, I picked out a size that they knew would be a good fit for me, and I had to pick them out so I knew what size expanders I would have to have. The day of surgery, I was super nervous and emotional. I took my shower and scrubbed my chest for 8 minutes, 3 extra minutes for good measure, with my required cleaner, and I checked into the hospital. My people came along, my family and my dear friend Katie were there. I got them all Cancer Sucks t-shirts, and everyone looked great. My husband and I went back right away, and I got changed into a gown and little booties. I took the required and mandatory urine pregnancy test, and I was like, really? Seriously? Yep. Hadn't had a period in 6 months, thank you chemo, but sure, you know what? Let's just do it to be thorough, right? The nurse started my IV in my hand, and I was saying goodbye to my port as well, which was another nice thing. I got a liter of fluids and some prophylactic antibiotics. Before going into the OR, I actually went over to radiology, and again, this might not be for everybody, but this is one thing that they did because they knew that my cancer was in the milk ducts. So I went over to radiology, and they injected blue dye into my nipple. And yes, it was in my nipple. It stung a little bit, kind of like a bee sting, but I just skipped over the local lidocaine because I was like, whatever, it's just one poke, and I didn't want a second one. I then went back to my pre-op room and waited for about an hour. In that hour, the dye moved from the nipple area down through the milk ducts and drained into the lymph nodes. That was how the surgeon knew what lymph nodes to remove during surgery. And the thought was that the main lymph node, also called the sentinel nodes, were the nodes that were likely positive for cancer and thus the vessel to kind of transport cancer to the rest of my body. So they removed those also. As time ticked away waiting for the surgeon, my anxiety level increased. So thank goodness I had my friend Katie there and my husband there and my family to calm my nerves. Anesthesia came in and they explained the process of going to sleep. They also gave me a little medication to calm my nerves and help fend off nausea, which I knew from other surgeries that I don't tolerate narcotics. I don't tolerate anesthesia very well, so give me all the meds. Just before I went back, the surgeon and the plastic surgeon came by to check on me one last time. I signed my consent and we were off. I kissed my husband and I hugged my parents, and the nurse anesthetist and I walked back into the room. I remember laying down on the OR table and I quickly asked the CRNA to give me something to calm down and put me to sleep. I remember laying there and I was crying because I was so anxious. I kept my cool all the way up until I got to the room, and then I lost it. Even though there were other staff in the OR with me, I felt oddly alone. And as I drifted off into sleep, my fantastic nurse held my hand, and then all I remember was waking up in recovery. Both surgeries, The removal of tissue and reconstruction took about 5 hours. The general surgeon started first and removed my breast tissue, nipples, my main sentinel lymph nodes, and as much skin as they could, while allowing enough room to stretch and close. He finished his part and the plastic surgeon came in. She started by separating my pectoral muscles from my rib cage in order to create a pocket for my expanders and future implants to sit. Once the pocket was created, she placed expanders underneath the muscle and secured everything by sewing the muscles back to my rib cage. By placing the expanders under the muscle, it stretched the muscles and skin to make space for my permanent implants later. Some patients get immediate implants, but because I was having radiation, I needed expanders. And per my radiation oncologist, radiating through a permanent implant isn't successful, and he wanted me to have the best outcome, so I went with expanders. Unknown to me, which was a positive thing, the plastics doctor put 500 cc's, about 2 cups of air, into each one of my expanders at the time of surgery, so I didn't wake up completely flat-chested. This was something I was very happy about. I knew I was going to be in pain, but I was terrified to lose my breasts. They were one body part I really liked about myself. So when I woke up with a little cleavage, life was good. I got to my room and I was told I woke up in recovery, but I don't remember that. My throat was sore from the breathing tube and my chest hurt. It hurt to breathe, but I was encouraged to cough and deep breathe so my lungs continued to expand. And, the nurse in me knows that you don't want to get air trapping, you don't want to get pneumonia, all that. The other great part was that my port was removed, and even though they put a catheter into my bladder, it had been removed at the end of surgery. The other great thing, I wasn't nauseated for like the first time ever. I wasn't tired and loopy, but I was really sore. I took off and I took the offered pain medications and nausea medications to stay ahead of things. I also had constant ice packs on my chest. They had an ACE wrap around my chest, which added some compression and counteracted the pain. It also kept my incisions and fluid drains secured and safe. I was in the hospital for 3 days, but being a nurse, I was pretty self-sufficient. I have heard that patients can have single mastectomies as same-day surgery. Wacky. Absolutely wacky. I know that it's probably an insurance thing, but in my experience, I cannot imagine going home the same day. Like I said, being a nurse, I was pretty self-sufficient. I was stripping my own drains. I got up to the bathroom on my own. I walked around with my family. I just needed them, really, honestly, the nurses, to get me fresh ice and meds. On the 3rd day, both surgeons cleared me to go off, and off I went. Before leaving the breast center, nurses brought me a care package, which included a stuffed animal to put over my chest underneath my under my seatbelt, and I was like, this is ridiculous. I have a pink puppy dog on my chest, but man, it was a lifesaver. It cushioned all the bumps, so they clearly knew what they were doing there. Over the next 8 weeks, I really tried my best to avoid complications. I wasn't always successful, but I did my best to avoid another bump in the road and delay radiation. And my best tip here is stay ahead of your pain, take your scheduled pain and bowel regime medications, and ice packs are your friends. If you want to learn more, check out my book. I wrote this while I was going through cancer treatment as kind of for a way for me to process things. And I found afterwards that it actually could help other people. So my book actually goes into a lot more details about my journey and just some tips and tricks that I learned along the way. You can check it out. It's available on Etsy, in my Etsy shop, and on Amazon. Thanks for listening, and make sure to check out the other videos in this series.